Now, psychosexual therapy, well, you might think, what's all that about? And I used to think that too. But it helps to address assumptions about that arousal response, I was talking to you about. Because if you don't know what normally happens, it just makes it a little bit harder to understand sometimes why things aren't working. It's education, health issues, partner's response, all the things that we've been mentioning earlier on about how people feel. Is your partner menopausal and has gone off sex anywhere? To be able to discuss that as part of your management, I think, is very important. It helps to create a language and focuses on clear, helpful communication. I had a guy recently, the clitoral tissue, wasn't sure where it was on a woman. I've had men who don't realise how sensitive the perineum can be or the testicular area to touch. Men not realising that as you get older, you may need more sexual stimulation to get that arousal response happening anywhere. So it just helps you to think a bit differently maybe, or in a different way to how you would normally. It can be focused and short term, or it can be longer term. So sometimes it might only be involved in 2 or 3 sessions, other times it may be more. And I'll often say to people, well, it's a new chapter of your life, and let's discuss how to improve it or change it. So discussing expectations is important. Self-focus is you finding out about yourself. Sensate focus are exercises that I may give couples to do to try and rekindle intimacy. The intimacy may be non-genital to start off with, so I avoid people touching genitalia, but then I may introduce that, especially with erectile dysfunction, because actually for a lot of men, if there's a psychological element to the erectile dysfunction, it's that fear of getting it up that makes it harder to get it up. If I don't want you to get it up, then it's easier and you can relax into your sexual encounter. So that's why there's sort of an exercise program that's involved. So it's done at home. That's the other thing that's very important to know, because sometimes people look aghast, like, God, have we got to come back and show you what we've been doing? So, it's all done at home in privacy, and you set time to do it. Do you remember when I said about being relaxed? For any of you to be sexually intimate, you need to set some time. For men who may be given hormone treatments for their prostate cancer, you may not have that desire anymore, but you may have to factor into your diary once or twice a week, you're going to either self-focus, touch yourself, or be with your partner to try and get your kit working, because if you don't use it, you'll lose it. So there are things that you should be thinking about. Yep. I'll just move through a few of the slides so we keep to time. This is about communication. Again, here with Frank and his partner, the communication was slightly different to what was expected. And again, I think that's quite common. We don't always know what people mean. You may not always know what you're being told about in your clinic appointments. The clinician may not always know what they're talking about. So communication's important. I get people thinking out of the box, thinking about sex aids, vibrators. Most people think a vibrator is to put inside a vagina, but it's not. There are all types of vibrators around. These are some cheap ones that I have to say I bought in BHS, and I bought a dozen at the time. So you can imagine what the woman at the till thought. But I didn't mind if someone nicked it out of my box at work at, $3.50 a go. It was a bargain. But there are some really nice ones around with cyber skin that touch warm. And they've got veins on. You can run it down the shaft of your penis and around your scrotal area, and it can feel nice. Sometimes you don't know what's inside the packets, do you, in the chemists? So I'm quite intrigued, especially when they're on offer, I buy them. And this one, I'll pass this one around, but I would like it back at the end unless it loses its power. If you see these, and Boots have them hanging around in their, you pull them off the thing, a bit like tissues and stuff, hanging down from their shelves. Durex Play vibrations. And if you press this little purple button, and you put it on the base of your penis and that uppermost, that can give quite a thrill to... Do you want to just pass that around? It's just... Yeah. There you go. You wouldn't know it was so powerful, would you? So they're £6. you know, and sometimes I mentioned it's extra stimulation. Strap-ons. I've seen guys who've had penile cancer and they have to have part of their penis removed. So you can get brown strap-on dildos, you can get pink ones. Masturbation using lubrication. When I teach people about Cavaject, I usually leave them in the room for 10 minutes and then I'll come back in. And I have to say, last week, the room I was in was quite cold. So I gave this guy his injection, and on my table, I've usually got bits and bobs because it helps you communicate. Oh, what's that for then? And we'll start talking. I'll sort of say, ban the KY jelly, it's horrible, it's cold and sticky. There are lots of nice lubricants around. And one of the lubricants I had on the table was heat. So he said, can I use some of the lubricant to masturbate with? I said, yeah, of course you can. I'll knock on the door before I come back in. And he picked up the heat one. So I said, well, why don't you use that one? Because it's so cold in this room, it might give you a bit of a warmth. But with the heat one, you can actually put it on your skin and blow over the top. And it's warm to the sort of, well, yeah, to touch, but also to the sensation. And they're often on offer in supermarkets, these lubricants, around by bandages and elastoplasts. So just think about it next time you're shopping. You can put them in. Vacuums we've mentioned, the lubrication. There's a really nice one you can get from Boots called VL. That's very wet and watery. Clothing, you know, if you feel that where you've got your scar doesn't look nice or it feels uncomfortable, don't go to bed in your scratchy cotton underpants. Get yourself a nice silky pair, because textures of what we wear can make us feel good or bad, can't they? And that's what you should be thinking about. You know, just think out of the box to how things have been. That's just a picture of some lubricants that are around, as I've been mentioning to you. This is one that I saw in a garden shop, and I had to laugh when I saw it because two-stroke engine oil. I was actually banned from using in a pharmaceutical talk in case men actually went out to buy it, but it did bring a smile to my face. So penile rehabilitation. Now, I've called this one the Grover model because I have to say, I am, and Darren, I'm sure, because we've been around for donkey's years, you hear a lot said over the years, don't you, about the penis, and thank God at last vacuum devices have come to the forefront because they've always been sort of a poor treatment choice, wrongly in the past. So, you know, I'm a strong advocate of vacuums, strong advocates of pharmacotherapy, but I'm also an extremely passionate that you have to initiate discussion about sexual function early. Pre-treatment. I want to see men, when you're being diagnosed, not 6 months down the line, 2 years down the line when you've had diddly squat input, because it's really having a big impact on you then. So I think we should be championing that men have this discussion and partners. I always say there are two arms to pharmacotherapy because initially, we used to talk about using Viagra, Cialis or Levitra to help you get an erection. And then in the past few years, there's become, well, Pfizer, who make Viagra, looked at 25 milligrams every night for a man post-radical prostatectomy to help their erectile function. Now, generally, you will not see what I would call a grade 4 erection, which is fully hard and able to get in a vagina with 25 milligrams post-radical prostatectomy of Viagra. You may do with 100 milligrams. So the vogue is with low dose of a tablet like Viagra, Cialis or Levitra following surgery, which you will hear about mentioned or you read about on the internet. The methodology for that is to stop the cells dying off that we've been hearing about earlier on, to keep these cells from stopping them to die off and give you the best chance of you getting your erectile recovery back. But generally, people aren't that bothered about the cells, especially if they're paying maybe £10 a tablet. But if you know that the other arm is, well, the more we can get your erection fully hard, like Tan said, 20 seconds, getting it to erection daily, you're stretching the tissue, you're maximising the tissue, that's good. And if it means that I can afford 4 tablets at 100 milligrams of Viagra or 20 milligrams of Cialis or Levitra to give me a grade 4, it's better to get that once a week than not at all. So I think at the moment we're still in the developing stages of knowing this low dose daily dosing and the effectiveness of it. So 25 milligrams of Viagra had been trialled, and because we then got this 5 milligram daily Cialis, which originally was licensed for men to use so they didn't have to think about sex and take a drug, people then now have been put onto 5 milligram daily Cialis because it's a similar action. And that's how it's come about. Now, in 10 years' time, we may have lots more evidence about how well that works. But at this present time, we're still in debate about it. Worldwide, meetings that I go to internationally, there is still discussion on the benefit. Vacuum constriction devices should be used. And I do think we should be combining it all with supporting you about the changes that are happening to you and your partner. So it's not just looking about drug therapy. And that's why I've sort of said the Grover model, because I've got no evidence-based research, as some of the pharmaceutical papers have. This is just my clinical experience over about 18 years. So in summary, health professionals have a vital role in supporting you and any partners, and also being aware of their own awareness. Do you remember when I said when I did Viagra trials and how embarrassed I was when I first started and didn't feel comfortable? Well, I'm sorry, it's 2012 now. We should be addressing it. And if your doctor doesn't feel happy about it, or your nurse, find somebody who is. Flexibility of treatment options, as I've said, it may be including bits of all sorts. And follow up if things aren't working, get further help. Don't just assume that's the end of the line. There's some references. I'm a trustee of the Sexual Advice Association, which is second down. We've got fact sheets which are free on our website. February the 14th is Thinking About Sex Day, which is coming up soon. And again, it's not to be avoided. It's give that kiss to your partner. Thank God you're there with them.